Michelle, and I'm going to be your nurse today. Can you tell me what your name and date of birth is?
Jerry Hicks, 8/12/97.
Okay. Can you tell me what day of the week it is?
It is Monday.
Can you tell me where we're at?
We're at my house.
Okay. And can you tell me what we're doing?
Helping you with your homework.
Okay. So through that, I was able to assess that she was alert, orienting times 3, including situation. And so just based on general assessment, she doesn't look to be in any distress. Her skin color looks to be a normal color. There's no gross abnormalities. Skin temperature is normal. So I'm going to go ahead and do vital signs. And I don't have a thermometer or a blood pressure cuff, but at this time I would do that along with this. But I am going to go ahead and get her pulse and her respirations. Great. Pulse was 62 and respirations were 18, so they were normal. And so now I'm also just gonna, we already kind of did a general skin assessment, said that the color was normal. There don't appear to be any lesions. Skin turgor is great on both hands. And we'll look at capillary refill. It's less than 3 seconds on our upper extremities. Less than 3 seconds on our lower ones. She does not have any swelling or edema. Checking for any pitting. Don't see any on our feet or our legs. So that's good. And then next, I am going to do the Glasgow Coma Scale. So already I can tell that she's blinking her eyes and able to move those spontaneously. She's responding correctly verbally. And then to obey a command, I'll check this by having her place her finger on her nose. So if you can just place your hand on her nose. Okay, so our Glasgow Coma Scale is 15. And also by our conversation so far, I can tell that her verbalization is appropriate, so her speech is good. And also she's able to hear me because she's responding accurately. And so next I am going to check her facial features, and they look normal. There doesn't appear to be any abnormalities, and also that her face is symmetric in the movement. So if you can just smile for me, okay, and frown, and make your eyes really big. Okay, so her facial movements are symmetric, and there's no drooping or anything like that. And so next, I am just going to look at head, ears, nose, and throat. So first, just by looking at her eyes, I can tell there's no redness, no drainage. Her sclera is white. Her pupils appear to be normal. And also just kind of looking at her ears, there's no drainage, no redness, or anything like that on first inspection. So now I'm just going to check her eye movements, muscular movements. So if you'll just follow this pin when I move it. And her eyes are moving appropriately. And then now I'm just going to have you look at this and follow it inward as I move it towards your face. So her eyes can accommodate. And then I'm also going to check to make sure that her pupils are reactive. So if you could just look ahead for me. Good. I'm going to do this again looking at the other one. And it reacts as well. I'll just do this on the other side. Good. And they're both round, reactive to light. Look great. So now I'm just going to kind of look in our nose. The mucous membranes appear to be pink and moist. And also, if you could open up your mouth for me. Mucous membranes are pink, moist. She has no tonsils. They've been taken out. There appear to be no decay on her teeth and no broken teeth. Next, I'm just going to kind of look at her ears. They look to be in the right place. Like we said, no redness, no drainage. And now I'm also just going to palpate her throat. Trachea appears to be midline, no abnormalities there. And so next I'm just going to do our pulmonary assessment. So just by kind of general inspection of the chest, she doesn't seem to be barrel chested, no masses or anything of that nature. I'm just going to palpate. I feel no masses, no crepitus. come down to the back and feel as well, known as cystocrepidus. Okay, and if you could just turn this way for me. Now I'm just going to palpate lung expansion. So if you could just breathe in for me. Great. Lung expansion is good. It's even. And so next I am just going to go ahead and percuss the lung. So if you could just turn back forward for me. Go ahead and do this on the front. Great. Okay, and then now next I'm going to go ahead and auscultate the lungs. Just breathe normally for me. Back as well. If you could just turn that way for me. Thank you. And lung sounds are clear in all fields. So this is going to be the end of our part 1 video.